Since women are at a higher risk of injuring their ACL, are there specific considerations for female patients regarding management, your surgical decisions, and and rehab? So there's some things that we could talk about with that.
So I think every patient there's considerations for rehabilitation. I think return to sport is everybody's goal, and so that's what we're working for. And the timelines have really shifted the last probably 5 to 10 years. It used to be 6 months, you cleared, great, you get to go home. And now we really have become an understanding of the return to sport testing, and it encompasses not only your strength, your jumping ability, how you land, how your muscles connect with your brain, and also, are you ready to return to sport? I think kinesiophobia, or fear of returning to sport, is very important. A lot of patients think about their knee when they're going back to soccer. They think about their knee, and that can really lead not only to injuries of your surgical knee, but of your other knee. So if you don't feel ready to go back, that's a very big consideration, in addition to making sure that your knee functionally is able to go back. Whether the athlete or the person feels ready to go back is also a big consideration that we've recently found is a big part of the return to sport.
And I'll just touch on that because I think that brings up a really good point. We talk often about the fact that the knee may be ready to go back to sport, but the head isn't ready to go back to sport, right? The patient themselves isn't really ready. And what does that mean? It means that for 9 months or something up to that, we've been saying, focus on your knee, focus on your knee, focus on your knee. And now all of a sudden, when they have to get back on the field or on the pitch or on the court, we're saying, stop thinking about your knee, start thinking about your sport, right? Because when you think about your knee while you're playing a sport, that's not a good way to return. It becomes something that the patients can have a lot of difficulty with. I think there's a lot of things that can help, and I think these patients go through a lot other than just the rehab of their knee, especially in our young athletes. They're coming out of their social support system, which is their team and their teammates, and I think that's extremely difficult and something that we don't always take into account when we're dealing with just the surgery and the rehab. We have to think about what their support structure is like and what their social structure is like. And so I think with our patients, and certainly since COVID and I think we were good before, but we're much better now at thinking about the mental health aspects of an ACL tear and how it impacts our young athletes. And so we have a sports psychologist who's wonderful within the Women's Sports Center, Deb Roche, who's really taught all of us that it's really we have to treat the whole patient. And I think that's critical, especially with these young athletes. And I think giving them tools as to how to get through the rehab and the return to sport, which is in itself a big deal, I think that helps them tremendously. And we should consider adding that into every patient we see, and certainly the ones that we can, that we either hear them express concerns or their parents. But I think it's something to think about.
It's so important. I think, we talk about elite athletes, professional athletes, and how devastating because of the financial consequences. But I think when you're dealing with a young athlete, their job in life is to play, and you take a huge chunk out of their life, and it's really, really devastating. So it's that mental health aspect is not from a standpoint of they're crazy. It's how do you manage the stress that comes, and how do you cope in teaching them strategies. And just to touch on your point, Dr. Q, about the kinesiophobia and fear of going back. After treating many, many, many people who've had ACL surgery and working with them as they return to sport, I think if they are not ready, if they're afraid of going back, we're missing something. I don't necessarily think it's a psychological thing. I think we have to really listen to them, and we use the SANE score, right? Ask them what they, rate their knee from 0 to 100, and then what do they think they're missing? And if you really listen to them, and sometimes they think our tests may not be sensitive or specific enough to hit on that point. So I think if they're afraid of going back, we have to go back to the drawing board. And what are we as rehabilitation specialists missing, and how do we get them ready?
And sometimes it's their knee that's afraid of going back, that's telling their brain that they can't.
Sure.
And so occasionally it is actually a knee that may be a little on the loose side or something about their knee.
Sure.
And that's what we have to think about as well. And we have to exclude that before we go to other issues.
Absolutely.
And that's one of our jobs. So when they see us in the office with this inability to get back to sport, our job as the surgeon is to make sure that their knee is fully stable and that it's not their knee, because the fear, or what we call apprehension, a very common thing when we talk
Sure.
about patella next, which is the kneecap, it's actually their body telling them that they're not ready. It's not 100%,
Absolutely.
it's probably 25% of the group that doesn't want to go back to sport. So but we have to look there first and make sure it's not their knee.
And I think one thing that we do very well is the relationship between the therapist and the surgeon, therapist and the physician to do best for that patient. So we all understand what's happening with that patient, and we really understand that it's a team approach. The patient is the center, but it really involves all of us communicating to get them back to what they want to do.
Yeah, I mean, rehabilitation is 99.9% of really any surgery. I mean, Dr. Shubin Stein and I can do a surgery and it takes us an hour to 2 hours, and then patient goes home, and then they're in rehabilitation twice a week for 9 months. And so they really develop a relationship with their therapist. And I think communication is important. I have all my therapists email me an update. They're doing great. Even if they're doing amazing, I want to know about that, because
Hmm.
then I can tell the patient, your therapist said you're doing great. And that really does help their perception of their knee and their recovery when someone is coaching them, not just to them, but also tells their surgeon they're doing great. And I can reiterate that and reinforce that they are doing well. And if they're not, we can figure out why. That's important to figure out what's going on early. We can intervene and either adjust the rehab or adjust something that we can do at home or something to encourage them, or something that we need to intervene on a little bit earlier than we thought. But open communication is critical to the recovery of our patients.
I think
Amen.
that's a great point, and I think the point that you made, certainly if they're doing well, that's wonderful, but I think the relationship is critical when something may be kind of early that's not going well. There are always issues that these patients I have. I always say, and we're here to, every time I check in with them, I'm here to develop a problem list, right? Is it your quad that's your issue? Is it, your hamstring that's your issue? Are you having trouble with stiffness? But I need to know when I see them. And these are all things that are somewhat expected throughout the course of their recovery. If we catch them early, we can prevent them from becoming an issue that stays with them throughout their recovery. We can address these issues early, and that's critical in getting the physical therapist to alert us.